the clonal hematopoiesis risk score was developed or derived rather in a population-based setting. So it is a tool that is really good at estimating population level risk. And it can tell you in a population of people with clonal hematopoiesis, either CHIP or CCUS designated, what their 5 and 10-year estimated risk of developing MDS, AML, or MPNs actually is. One of the things that it's not good at is estimating risk in certain select clinical contexts. And so for the practical hematologist, you can kind of get a sense of, based on the molecular details of a patient, as well as their blood counts and their age, you can get a sense of whether or not in the population they would be considered low, intermediate, or high risk for progressing to a blood cancer. But then when you layer on top of that clinical context, like sickle cell disease or like cancer chemotherapy or radiation therapy, you actually accelerate that risk even further. And that's not accounted for in the CHRS. And so what I would tell to the hematologist using our score is that it's effective as a sort of population level estimate, but it's also important to sort of think about the clinical context in which you're seeing the patient and understand that there are other clinical features, such as the exposures that a person is experiencing, that can sort of accelerate the risk beyond what can be estimated by the CHRS.